Good afternoon, student. Today is the lecture of the surgery, that is in the ophthalmology. In the ophthalmology, we will continue today's lecture with the diseases of the retina. Before we start the diseases of the retina, firstly we know the applied anatomy. Hello? Huh? Oh, good afternoon. Hello? बोल ना. Hmm. Hmm. Okay. Hmm. Okay. बरं बरं. हां हां हां. हां. ओल्ड सिलेबसमध्ये का? हं. हं, 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 हं. ओके. हं, हं. बरं, बरं. हं, हं, हं. ठीक आहे, चालेल. मी पाहते, मी तुला कॉल करते नंतर. आता मी लेक्चर स्टार्ट करू. हां. हो. हं. So, before we start the diseases of the retina, we will first study the applied anatomy of the retina. Retina is the innermost unit of the eyeball. It is a thin, delicate and transparent membrane. It is most highly developed tissue of the eye. So it appears purplish red due to the visual purple of the rods and underlying vascular core. Gross anatomy of retina can extend from the optic disc to the ora serrata. So grossly it divided into the two distinct regions, posterior pole and peripheral retina, separated by the so-called retinal equator. And retinal equator is an imaginary line which is considered to lie in line with the exit of fovea vertigo. Posterior pole refers to the area of the retina posterior to the retinal equator. The posterior pole of the retina includes the two distinct areas. That is, in one is the optic disc and macula lutea. The posterior pole of the retina is best examined by slit lamp, indirect biomicroscopy using plus 78D and plus 90D lens, and direct ophthalmology. So, retina is the innermost unique eyeball. It is thin and delicate transparent membrane, so it is highly developed eye tissue. It is bluish purplish red due to the purple color of the rod and vascular core. In retina, it extends from the optic disc to the ora serrata, and it is grossly divided into the two parts. First is the posterior pole, and second, that is peripheral retina. And it is these two parts are separated from each other by the retinal equator. So, retinal equator separate posterior pole and the peripheral retina. So, it is the imaginary line, and posterior pole is the area which is posterior to the retinal equator. So, posterior pole of the retina, it includes the two parts, that is optic disc and macula lutea. And posterior pole of retina is examined by the slit lamp indirect biomarker and direct ophthalmoscopy. Then the optic disc. Optic disc is a pink color. It is well-defined circular area of 1.5 mm in diameter. At the optic disc, all the retinal layer terminates except the nerve fiber. Nerve fiber are passed through the lamina fibrosa to run into the optic nerve, and a depression seen in the disc is called as a physiological curve. The central retinal artery and vein emerge through the center of these curves. So, this is the optic disc. This one. The optic disc is a pink color. It is a well-defined circular area, 1.5 mm diameter. And at the optic disc, all retinal layers are terminate. But nerve fiber do not terminate at the optic disc. Nerve fiber pass through the lamina fibrosa and run into the optic nerve. So here the optic disc and this is the optic nerve. So nerve fiber are run through the optic nerve. Then a depression seen in the disc. It is called as a physiological cause. At the disc there is a depression which is called as physiological curve, and the central retinal artery and vein which emerge through the center of this curve. So there is a central retinal artery and central retinal vein which is emerged through the center of this physiological curve. Then the macula lutea. This one is a macula lutea. It is also called as a yellow spot. It is comparatively deeper red than the surrounding fundus and is situated at the posterior pole of the temporal to the optic disc. It is about 5.5 mm in diameter. Fovea centralis is the central depressed part of this macula and it is about 1.5 mm in diameter and is the most sensitive part of the retina. So in its center is a shining pit. It is called as the fovea, which is 0.35 mm diameter and which is situated about 2 disc diameter, that is 3 mm away from the temporal margin of the disc and about 1 mm below the horizontal meridians. An area about 0.8 mm in diameter, which including the foveola and some surrounding areas, which does not contain any retinal capillaries and is called the foveal avascular zone, that is FAZ, and which surrounding the fovea are the parafoveal and perifoveal areas. So, macula lutea is also the other name is the yellow spot. It is comparatively deeper red. It is more deeper red than the surrounding fundus. The macula lutea is surrounded by a fundus and it is situated at the posterior pole temporal to the optic disc. So, at the optic disc, macula lutea is situated temporal to the posterior pole. It is about 5.5 mm diameter. So there is a fovea centralis, is a central depressed part of the macula. Like a depressed part with the center of optic disc is a physiological curve. Like that, the macula lutea has a central depressed part which is a fovea centralis and is about 1.5 mm in diameter. So it is the most sensitive part of the retina. In its center is a shining pit called as the fovea, which is 0.35 mm diameter and which is situated about 2 disc diameter, that is 3 mm away from the temporal margin of the disc and about 1 mm below the horizontal meridian. An area about 0.8 mm in diameter, which is including foveola and some surrounding area, which does not contain any retinal capillaries. and is called as the foveolar avascular zone, that is AFAZ. And surrounding the fovea there are parafoveolar and perifoveolar areas. So when we see the diagram, in the diagram of the eyeball, this is the optic nerve. In just above that, this is optic disc. This is fovea. This blue is a choroid. Just under the choroid, there is a retina. This one is a sclera, and this is the ora serrata. And when we see a diagram B, that which shows the optic disc, this one is the ora serrata. Then this out small circle just in between that is the parafoveal region. The center most point is the foveola. Just behind that there is a foveola, then retinal vessels and peripheral retina. So the peripheral retina refer to the area which is bounded posteriorly by the retinal equator and anteriorly by the ora serrata. Peripheral retina is best examined with indirect ophthalmoscopy and by the use of the Goldman 3 minor contact lens with exam. So this is about the peripheral retina. That it is the area bounded posteriorly by the retinal equator and anteriorly by the ora serrata. So this one is the ora serrata. Ora serrata is this, and this is a peripheral retina. So peripheral retina is bounded posteriorly by retinal equator and anteriorly by the ora serrata. It is examined by indirect ophthalmoscopy and by the use of Goldman 3 minor mirror contact lens. Then ora serrata, it is the serrated peripheral margin where the retina ends. Here, the retina is firmly attached both to the vitreous and the choroid. Is firmly attached to both to the vitreous and the choroid. The pars plana extend anteriorly from the ora serrata. The microscopic structure shows that retina consists of three types of cells and their synapses arranged from within inward in the following 10 layers. That is, first one is a pigment epithelium. It is the outermost layer of the retina. It consists of the single layer of the cell containing pigment and it is firmly adherent to the underlying basal lamina, that is a bruised membrane of the corona. So, this is the pigment epithelium. This is the first layer of the microscopic structure of the retina. Okay. So it is outermost layer of the retina and it consists of the single layer of the cell which containing the pigment and is firmly adherent to the underlying basal lamina, that is rouge membrane of corona. Then second is the layer of the rods and cones. This is the layer of the rods and cones. So these are the rods and these are the cones. Rods and cones are the end organ of the vision and are so known as photoreceptors. So layers of the rods and cones contain only the outer segment of photoreceptor cells which arrange in palisade manner and there are about 120 million rods and 6.5 million cones. So Rods and cones so are the end organ of the vision and are known as the photoreceptors. So the layer of the rods and cones containing only the outer segment of photoreceptor cell and arranged in a palisade manner. So there are about 120 million rod and 6.5 million of the core. Then rods contain a photosensitive substance which is visual purple, that is rhodopsin, and subserve the peripheral region and the region of the low illumination, that is scotopic region. And the cones also contain a photosensitive substance and are primarily responsible for highly discriminatory central vision, that is the photopic vision and the color vision. So rods is a photosynthesis substance which contain a purple, that is rhodopsin, and subserve the peripheral vision and the vision of the low illumination, that is scotopic vision. And cones also contain a photosensitive substance and primarily responsible for highly discriminating central vision, that is photopic vision and the color vision. Then the gross anatomy of the retina is A, that is the parts of the retina in horizontal section at the level of the fovea. Diagrammatic fundus view C is the fundus photograph. Third, that is external limiting membrane. External limiting membrane is this. This contains this present below the layers of the rods and cones and just above the outer nuclear layer. External limiting membrane, it is fenestrated membrane through which passes processes of the rods and cones. Then outer nuclear layer. It consists of nuclei of the rod and cone. So this is the outer nuclear layer in which there is a rod nucleus and a cone nucleus. So this is the outer nuclear layer which contain a rod nucleus and this circular is the cone nucleus. Then outer plexiform layer. So it consists of collection of the rods, spherules and cone pedicle with the dendrite of bipolar cells and the horizontal cells. So this is the outer plexiform layer just below the outer nuclear layer. Then inner nuclear layer. It mainly consists of cell bodies of the bipolar cell and it also contains the cell bodies of horizontal, amacrine, Muller cell and the capillaries of the central artery of retina. The bipolar cell constitute the first order neuron. So this is the inner nuclear layer. Inner nuclear layer contain a amacrine cell. These blue are horizontal cell and bipolar cell. Then ganglion cell layer. It mainly contains the cell bodies of the ganglion cells, the second order neuron of the visual pathway. These are two types of the ganglion cell. So this is the eighth layer, that is ganglion cell layer, which contain a ganglion cell. The midgate ganglion cells are present in the macular region and dendrite of each such a cell synapses with the axon of single bipolar cell, and polysynaptic ganglion cells lie predominantly in peripheral retina, and each such cell may synapse with up to 100 bipolar cells. Then the nerve fiber layer. So this is a nerve fiber layer which consists, that is stratum opticum, which consists of axons of the ganglion cells which pass through the lamina fibrosa to form the optic nerve and for distribution and arrangement of the retinal nerve fibers. Then 10, that is internal limiting membrane. It is the innermost layer and separate the retina from vitreous. So it is formed by the union of the terminal expansions of the Muller's fibers and is essentially a basement membrane. So this is the internal limiting membrane, that is basement membrane of the microscopic structure of retina. Then the structure of the fovea centralis. In these areas, there are no rods, cones are tightly packed and outer layer of the retina are very thin. Microscopic structure of the fovea centralis shows that there is a inner nuclear layer, that is this green spot. Then this one is the inner plexiform layer. This black dot is the ganglion cell layer. Just above that there is a nerve fiber layer, and this line is the internal limiting membrane, and the center part is the foveola. Then there is this pink is the retinal capillaries. Just below that there is a Henle, that is outer plexiform layer, then outer nuclear layer, then these are the elongated cones, pigmented epithelium, and the choriocapillaries. So these are the choriocapillaries. It is a central part, that is foveola, which largely consists of cones and their nuclei, which are covered by a thin internal limiting membrane, and all the other retinal layers are absent in this region. So in the foveal region surrounding the foveola, the cones axons are arranged obliquely, that is Henle layer, to reach the margins of the fovea. So when we see this is the foveola, and just below that there is a outer nuclear layer, and under that there is a outer plexiform layer in which it contains longitudinal lines foveal region surrounding the foveola and the cornexons are arranged obliquely, that is Henle layer, to reach the margin of the fovea. Then the functional divisions of the retina. Functionally, retina can be divided into the temporal retina and the nasal retina by a line drawn vertically through the center of the fovea. Then nerve fibers arising from temporal retina which pass through the optic nerve and optic tract of the same side, which to terminate in the ipsilateral geniculate body, while the nerve fibers originating from the nasal retina after passing through the optic nerve cross the optic chiasma and travel through the contralateral optic tract, terminate in the contralateral geniculate body. So, functionally, retina is divided into temporal and the nasal retina, and the line drawn vertically through it is called as the center of the fovea. Then, the nerve fibers arising from the temporal retina, which is passes through the optic nerve and optic tract of the sensor. So, it terminates in the ipsilateral geniculate body, while the nerve fibers originating from the nasal retina after passing through the optic nerve, cross the optic chiasma and travel through the contralateral optic tract to terminate in the contralateral geniculate body. Then the blood supply is, that is outer four layer of the retina, that is pigment epithelium, layers of the rods and cones, external limiting membrane and outer nuclear layer that get their nutrition from the choroidal vessels. So this is a blood supply of the retina, that is pigment epithelium, layers of the rods and cones and external limiting membrane and outer nuclear layer. They get their nutrition from choroidal vessel. Inner six layer get their supply from the central retinal artery, which is the main branch of the ophthalmic artery. So these inner six layers have their supply from the central retinal artery. Central retinal artery is the branch of the ophthalmic artery. Central retinal artery emerges the center of the physiological curve of optic disc and divided into the four branches, that is namely the superior nasal, then superior temporal, inferior nasal and inferior temporal. So these are the end arteries and they do not anastomosis with each other. So central retinal artery is the branch of the ophthalmic artery and central retinal artery emerge in the central of the physiological curve, that is a depression in the center of the optic disc and divided into the four branches, that is superior nasal, superior temporal, inferior nasal, inferior temporal. So these are the end arteries and they do not anastomosis with each other. Then the retinal veins. These follow the pattern of the retinal artery. The central retinal vein drain into the cavernous sinus directly and through the superior ophthalmic vein, and the only place where the retinal system anastomosis with ciliary system and is in the region of the lamina crepus. So the central retinal artery always follow the pattern of the central retinal arteries. Central retinal vein these follow the pattern of the retinal artery. The central retinal vein drain into the cavernous sinus. So directly or through the superior ophthalmic nerve, and the only place where the retinal system anastomosis with ciliary system and is in the region of the lamina previosa. Then this is the applied anatomy of the retina. Then congenital and developmental disorders classification. In that, first is the anomalies of the optic disc. So anomalies of the optic disc include the crescentus, situs inversus, congenital pigmentation, coloboma, glucine, and hypoplasia of the optic disc. Then second, that is anomalies of the nerve fiber, for example, modulated opaque nerve fibers. 3. That is anomalies of vascular element such as persistent hyaloid artery and congenital tortuosity of retinal vessel. Fourth, that is anomalies of the retina proper. So these include albinism, congenital night blindness, congenital day blindness, Ullrich disease, congenital retinal cyst, congenital retinal detachment, and coloboma of the fundus. Fifth is congenital anomalies, which of the macula are aplasia, hypoplasia, and coloboma. And a few important congenital disorders are described briefly. So these are the congenital and developmental disorders classification. That is anomalies of optic disc, anomalies of nerve fiber, anomalies of vascular element, then anomalies of the retina, and congenital anomalies of the macula. Coloboma, coloboma of the optic disc. So it results from the failure in the closure of the embryonic fissure. It occurs in two forms. The minor defect is more common and manifests as inferior defect, usually in association with hypermetropic or astigmatic refractive error. And the fully developed coloboma is typically present inferonasally as a very large whitish excavation which apparently looks as the optic disc. The actual optic disc is seen as a linear horizontal pinkish band which is confined to a small superior ridge. Then defective vision and a superior visual field defect is usually associated. So when we see the coloboma of the optic disc, it results from the failure of the closure of embryonic fissure. So it is a congenital disorder where there is a failure in closure of embryonic fissure. So it occurs in two forms, that is the minor defect is more common. It manifests as inferior crescent. and usually associated with hypermetropic or astigmatic refractive error. And the fully developed coloboma is typically present inframucosal. So, as a very large white excavation which apparently look as optic disc. Then the optic disc is seen as a linear horizontal pinkish band which is confined to a small superior ridge, and this defective vision and a superior visual field defect is usually associated. Then drusen of the optic disc. Drusens are intrapapillary refractile bodies which usually lie deep beneath the surface of the optic disc tissue in the child and emerge out by the early teens. Thus, in children, they present as a pseudo papilloedema, and by teens, they can be recognized ophthalmoscopically. So, as a waxy pea-like irregular refractile pods. So, the drusen of the optic disc is an intrapapillary refractile body and usually lie deep and beneath the surface of the optic disc tissue in childhood and emerge out by the early teens. So, thus in children they present as a pseudo papilloedema, and by the teens they can be recognized as ophthalmoscopically as a waxy pea-like irregular refractile body. Then hypoplasia of the optic disc. Hypoplasia of optic nerve may occur as an isolated anomaly or in associated with other anomalies of central nervous system. The condition is bilateral in 60% of cases and is associated with maternal alcohol use, diabetes, and intake of certain drugs in pregnancy. It forms a significant cause of the blindness at the birth in developed countries, and diagnosis of mild cases presents a little difficulty. So, in a typical cases, the optic disc is small and surrounded by a yellowish and a pigmented ring, which is referred to as the double ring sight. So, when there is a hypoplasia of optic nerve, which may occur as an isolated anomaly or in association with other anomalies of CNS, that is central nervous system, and the condition is bilateral in 60% of cases. So, it is associated with the maternal alcohol use, diabetes, and intake of the certain drugs in pregnancy, and it forms a significant cause of the blindness and at birth in developed countries. So, there is a diagnosis of mild cases present little difficult. In typical cases, the yellowish or pigmented ring, which is called as a double ring sign. Then, a medullary nerve fibers. These, also known as opaque nerve fibers, represent myelination of nerve fibers of the retina. Normally, the medullation of optic nerve proceeds from brain downward to the eyeball and stop at the level of the ramina fibrosa. So occasionally the process of myelination continues after birth for an invariable distance of nerve fiber layer of the retina beyond the optic disc on ophthalmoscopic examination. These appear a whitish patch with feathery margins and usually present adjoining the disc margin. The transversing retinal vessels are partially concealed by the optic nerve fiber. So, mediated nerve fiber is also known as the opaque nerve fiber. So, it represents myelination of nerve fiber of the retina. And normally, the medulation of the optic nerve proceed from brain downward to the eyeball and stop the level of the lamina previosa. So occasionally the process of myelination continue after birth for an invariable distance of the nerve fiber layer of the retina, which is beyond the optic disc on ophthalmoscopic examination. And these appear a whitish patch. So this feathery margin also present adjoining the disc margin and transversing retinal vessels are partially concealed by the opaque nerve fiber. So such a lesion characteristically exhibit the enlarged blind spot on the medullary sheath and disappear in demyelinating disorders and optic atrophy due to the any cause, and thus there is a no trace of this abnormality is left behind. So this is the diagram of the opaque nerve fiber. This is hmm, these are the opaque nerve fiber. So which are seen in the case of the medullary nerve fiber, that is which is characteristically exhibit enlargement of the blind spot on medullary sheath disappear in demyelinated disorder and optic atrophy due to the any cause, and thus there is a no trace of this abnormality is left behind. Then persistent hyaloid artery. The congenital remnants of hyaloid arterial system may persist in different forms. Vagabond's papilla refer to the flakes of glial tissue which projecting from the optic disc, and is the commonest congenital anomaly of the hyaloid system. Vascular loop or a thread of obliterated vessel may sometimes be seen running forward into the vitreous, and it may even be reaching up to the back of the lens. And methane drop dot that represent the remnant of the anterior end of hyaloid artery, which is attached to the posterior lens capsule and is usually associated with the posterior polar cataract. So, these are the congenital and developmental disorders classification, that is anomalies of optic disc, nerve fiber, vascular element, retina proper, and the macula. Then the coloboma of the optic disc, drusen of the optic disc, and hypoplasia of the optic disc, medullary nerve fibers, and persistent hyaloid artery, that is Bragg-Mitz papilla, vascular loop, and Mittendorf duct. So, in the next lecture, we will continue ophthalmology with the inflammatory disorders of the retina. So today we stop here.